walk you through.
Awesome. Yeah, we can see it. Um, walk us through this if you can, Jessica.
Sure. So we originally kind of based this off a maturity model. So kind of that step measurement where you're reading from kind of left to right. So in the purple, this is a team. So again, this is looking from a team perspective, and a team on a journey of joy in work and well-being. So a team that's kind of in this unaware phase, moving all the way up into the sustain. And you can see within the various columns, so the unaware, explore, know, capable, and sustain, you've got various categories. Um, and the categories are how you may feel as an individual, and also how the team may feel and act as well. So there's kind of two parts to that. So you can see that first category is my inner voice says. So in the unaware, you are just kind of getting through the day. But when you're in more of that capable and sustain, it's my inner voice is saying, I enjoy coming to work and my work has meaning and purpose. Another example, I guess, of a category is the joy journey. So this is how a team is kind of moving through a quality improvement journey. So in this unaware, you're kind of that rigid, inflexible system, and change is feeling hard, change is feeling like a burden to the team. And then you move along and, quality improvement just becomes a way of being. The team was working together on projects, and then it just becomes where QI is just your daily practice. Change is great, change is exciting and positive, and the team is just kind of craving that. And again, average day feels, you're moving from an impossible, just trying to get through your day, all the way into feeling really optimistic and fulfilled at the end of your day. And, we're also saying these are just suggestions. You could take this to your team and you could actually use, this could be blank, and your team, you could use it as more like a team canvas, and you could populate it with language that works for you and your team. So yeah, it's just a way to create some dialogue. It's a way to engage, and it's a way to measure your journey throughout along the way.
Mm-hmm. What a fantastic framework to get conversations going, like you'd said earlier, that this can just be a conversation starter, or
Yeah.
it can be used as part of a survey, or as
Yeah.
a self-assessment.
Yeah.
It's
Yeah. I
fantastic.
mean, we're learning with teams from Fraser Health have actually, kind of made this into a survey so that, unaware is 1, and then sustain is 5. And so, measuring that along the way. So you have a bit more of a quantitative way to, put forward how the team is doing. And then qualitatively, yeah, you can measure it just with, what people are saying. So I think there's multiple ways that you can use this.
That's awesome. Marianne, anything to add as you listen to Jessica present this model that you co-created?
I think I would also give kudos to LeeAnn and Daisy, our physician supporters, leads. I don't know what their official title is through
Well, their
SSC.
official title is co-lead of spreading quality improvement in the province.
Perfect.
Yeah, under Doctors of BC.
They have hugely helpful and supportive of our spread work within interior health. They do learning sessions. They have done learning sessions with each of the different SQI projects around the province. And I don't know how it went with all of the other teams, but for us, they totally redid their learning sessions and their slide decks to really look more at joy in work and safety too, and leading from excellence, and incorporated tools like ours into that work, so that as our 3 teams within our group are working along, it's a combination of everything LeeAnn and Daisy know, supported by their learnings, and all of our combined learnings together.
Mm. Thank you. If the listeners want to learn more about safety one, safety two, or about learning from excellence, kind of assets and strengths-based approaches, and what are some resources you might recommend that they look into?
If you Google learning from excellence, you'll go straight to the website and then there's a great little paper that the Plunketts wrote, there's a husband and wife, I believe they're husband and wife,
Hmm.
specialist couple from Britain, wrote a paper about 3 years ago. And I'd have to look it up, but it's just a great summary on all the different ways you can bring positive deviance and asset-based work into quality improvement and team approach. And then Safety 1, Safety 2 was put forward by Hollnagel. If you Google Hollnagel, Hollnagel, you'll get the original paper
That's
on safety.
Holl
Nagel,
Hall
Eric,
Hollnagel.
El.
Okay,
You
and
get
that
his paper. Anything you'd add there, Jessica? Or you can reach
Yeah,
out to one of us because
this is this is the
we've
power
got a
of the
great lit
dyad
search.
partnership. I've got the article is for the Plunkett article that Marianne was referring to. It's positive approaches to safety, learning from what we do well. I agree. It's a fantastic article that summarizes just, from exnovation, which is also a cool topic. And yeah, all of the pieces about being asset based, and reframing, that really fits with the joy in work kind of mentality. And the Hollnagel article is from 2015, and it's a white paper. It's a white paper about safety too, and the whole kind of journey. I mean, really, it talks about the journey in patient safety from being in safety 1 and looking at the deficits and looking for, the one thing in 99 that went wrong, in shifting into the safety 2 mindset, which is looking at asset based and looking at the 99 things that went right.
What a lovely message. You mentioned, Marianne, that people could contact you if they were interested. How might they reach you? I'll start with you, Marianne, and then I'll go to Jessica.
Probably my interior health email would be great. So marianne.morgan@interiorhealth.ca.
No, that's MARIANNE.MORGAN at interiorhealth.ca. Yeah. How about you, Jessica? Are you open to people reaching out to you?
Absolutely. Yep. So same for me. So jessica.barker@interiorhealth.ca.
That's great. Anything else you guys want to add before we close up the conversation?
I think I would add that this work is hard.
Mm.
And this work can be tough. If you're following kind of the joy in work steps, which start with, asking what matters to you and what are the pebbles in your shoes and what are the things that we can work on as a team, you're going to hear some tough stuff, especially as a leader. And you kind of have to be ready for it. And you have to be ready to navigate that with you and your team. Staffing issues are always going to come up that the team wants to change or deal with. And that might not be within your span of control. But I think my advice is to look at what is in your span of control. Your span of control as a leader, your span of control as a team, and really focus on some of those things first. You also need engagement from senior leaders in this. And that was part of our journey as well, is making sure that we were doing presentations to our senior executive team, that they were, we had quality improvement leaders engaged from within interior health and provincially. And that has been really important in our journey for kind of moving things along, and are important for breaking down some of those barriers. And also when some of these larger issues are coming up within a team, that the team is feeling like they're being heard and that these issues are being presented, at levels where they can be actioned. Because that's what it takes, is showing to the teams that we're hearing them and we are actioning these things that they're bringing forward. So and you need a buddy. Like, I think this, again, we talk about the power of dyads. Like, to know that I have Marianne in this is huge. It has been a journey of ups and downs. And there's times when we've absolutely wanted to quit or throw in the towel, but here we are. And I think it's truly is because we do have each other. And when one of us is feeling the low, the other person can say, okay, let's look at the positive in this, or let's just keep, on this. And yeah, that's been a huge part of why we're still here.
I think there's so many lessons in what you just shared that each of us has to find our sphere of influence and accept the
Yeah.
what we can do within that sphere of influence, understanding what we can control and what we can't, and not getting bogged down by all the myriad of different things in the larger system, and recognize that our influence sometimes is all that we need to focus on.
Yeah.
Marianne, any challenges of executing on join work that you can think of that you'd like to share with listeners?
I think the last thing I'd share is it just takes time, this work as well. So don't expect quick results. And I think sometimes you can feel pressured within an operations world that, well, where's your data? Where's your information that you've improved things? And it sometimes takes time. And sometimes, and I think the high information, and probably you've experienced this, Lawrence, with your join work is sometimes things get worse before they get better. If you ask people what matters to them and how they are, sometimes that can create havoc to begin with, but sometimes you need
Mhm.
to hear everything that's going on and create the chaos before you can heal the team.
It's really interesting. I love how you used the term "heal the team" because it really is healing. When I work with my patients as a family physician, often what I try to do is create a container, a space and container for them to offload their worries and their burdens, because their psychological, emotional, physical challenges that they're suffering from, if they're held too tightly within the body and they haven't let them out, it causes physical symptoms. It really does. And I think that even the work in palliative care is about you're creating safe spaces for comfort for humans to offload things that are bothering them. And in the join work space, you're creating containers and spaces where people can speak some of the things that they have not felt listened to about. And as you said, Jessica, people need to be heard and validated to feel safe. And once they feel safe, improvement and changes can happen. Wow. I just want to thank you both for this wonderful work.